Hi.
Hello, how are you?
I'm fine, thanks.
I will be going over the Miralax Prep instructions for your colonoscopy. 5 days prior to your exam, you should stop smoking, taking aspirin, iron products, and Coumadin or ginkgo biloba, and ibuprofen or any anti-inflammatory products. If you are taking Coumadin, have diabetes, or have been instructed not to stop any medications by your physician, contact our office to determine the dose schedule. Please continue all other medications as ordered and review the products to avoid sheet with your handout. Items to purchase at your local pharmacy or grocery store are 1 bottle of Miralax, 238-gram bottle, or a 255-gram bottle. A box of vesicoidal tablets. You will need 2 of them. They are over the counter. 1 bottle of magnesium citrate, a 10-ounce bottle. Lime only, no cherry. However, do not buy this item if you are 75 years or older, or if you are a diabetic, have congestive heart failure, coronary artery disease, renal disease, or taking diuretics. 1 bottle of Gatorade, 64-ounce bottle. 2 days before the procedure, start to hydrate yourself by drinking 64 ounces of water, aside from the liquids taken during your meals to avoid dehydration. That is 8-ounce glasses of water throughout the day. The day before, you will be on a clear liquid diet for the entire day. Do not fast. No milk, no dairy products, no juices with pulp, no red, orange, blue, green, or purple dyes. Yellow and clear liquids include chicken or beef broth, clear protein drinks, clear juices or Crystal Light, popsicles, Jell-O. No solid food of any kind, clear liquids only. Take your usual prescription medications, except iron and aspirin products. If you are a diabetic patient, take your diabetic medications in the morning of the prep. Skip the evening dose. Monitor your blood sugar at your usual time. Adjust your blood glucose accordingly. At 8 p.m., please drink the 10-ounce bottle of magnesium citrate. At 2 p.m., you can prepare your Miralax solution, which is to take the Miralax powder, pour the whole bottle into a pitcher with the 64-ounce bottle of Gatorade. You're going to mix it all up. You're going to put it in the refrigerator. At 3 p.m., drink the 10-ounce of Miralax solution every 20 minutes until you finish 32 ounces, which is half of the solution. Place the rest in the refrigerator for later. Nothing to eat or drink after midnight except for the remaining 32 ounces of the Miralax solution, which must be consumed 4 hours before your procedure. The day of your colonoscopy, please take your usual blood pressure medications the morning of with a sip of water. All other medication can wait until after the procedure is finished. If a biopsy is performed, do not take any aspirin products 7 days after to lessen the risk of bleeding. If you are diabetic, you should not take your diabetic pills this morning, but bring the dose with you and a snack to take after your colonoscopy is done. Please arrive at the center indicated on your instruction sheet at the time specified. Please provide a 5-day advance notice of any change to this appointment, or there will be a cancellation fee. Please arrange for someone to drive you home, as you will be sedated for the exam. Do not operate heavy machinery, make important decisions, or purchase any major items for the rest of the day. The day after, you should be back to normal and resume regular activities. Make sure to drink 8-ounce glasses of water to flush out any remaining prep solution out of your bowel. The doctor will talk to you after the exam and will give you recommendations for diet, medication, and follow-up care. But you may not remember. Therefore, he will also give you these instructions on paper. Please review those documents again later. He generally recommends to follow up in 2 weeks after the procedure to go over the results and address any questions or concerns you may have. Wear comfortable clothing, bring your glasses, hearing aids, insurance cards, and completed information form. You may need to verify your coverage with your insurance company regarding anesthesia. Some plans do not cover anesthesiology fees. You may receive 4 separate bills for this procedure, 1 from the doctor, 1 from the facility, 1 from the anesthesiologist, and if a biopsy is done, 1 from the lab. If you have any questions, please call 805-719-0244, or additional information can be found at our website, www.agimedical.com. Okay, the doctor will come in a moment to answer any of your questions.
Hi,
Hi.
how's it going? So I heard that you had some questions to ask me?
Yes, I do.
All right, excellent.
What is a colonoscopy?
A colonoscopy is an exam where I use a flexible, thin, lighted tube that I advance it throughout your colon to see a magnified image of the lining of your colon.
When is it used?
Well, it's used for many different reasons, but the most common reason why we do a colonoscopy is for patients after age of 50 to detect colon cancer and prevent colon cancer. The frequency of which colonoscopy should be done depends on what we find on the initial exam. Generally, that's about 3 to 5 years. You may hear that colonoscopy follow-up should be done every 10 years or so. That's usually promoted by your insurance company. The truth of the matter is that no matter how good of a colonoscopy somebody is, there's about 1% chance of missing tiny polyps. Those polyps can actually turn into cancer in a 10-year period. So 10 years could be a little bit of too long of a frequency that we would have to wait. All right? There are other reasons why we do colonoscopy is to find out what's wrong with patients. Sometimes you may have abdominal pain or changing bowel habits, and we do colonoscopy to find out what's wrong. And that helps me formulate some kind of treatment plan. Sometimes we do colonoscopy in the younger patient population than 50 years of age, such as when patients have either family history of colon cancer or they have other conditions that put them at risk of colon cancer. So it can be done at any age for those reasons. All right?
What happens during the procedure?
The procedure is done either in the hospital or in an endoscopy center. All right? When you arrive to the center, the nursing staff will take you in. They monitor your vitals. They check your blood pressure, your oxygen saturation, your heart rate, temperature, all that stuff. And they put a small intravenous catheter through your vein, through which I give you sedation, or an anesthesiologist can give you anesthetic. The safest and best way to have this procedure done is with an anesthesiologist who gives you medication to go to sleep. But if you have a certain insurance plan, they don't accept to pay the anesthesiologist. So the only option that you will have is for me to give you some sedatives, which may or may not make you completely go to sleep. All right? If you would like the anesthesiologist to be there and help, you may want to make other arrangements with them. All right? Either with the physician anesthesiologist or the anesthesiology group. You can also visit a website that gives you more information about this. It's called www.sedationfacts.org.
What happens after the procedure?
Generally, after the procedure, you feel fine. But sometimes you may have a little bit of cramping or abdominal discomfort, which has to do with the air that we put in the colon. This air can be passed very easily right after the procedure. The sooner you pass the air, the better you'll feel. All right, that's the most common thing that happens with patients after the procedure. You will also be kept in the recovery area after the colonoscopy, which, by the way, lasts about 15 to 20 minutes until you're able to walk and go home. Although you're going to feel fine, you are not allowed to operate any heavy machinery, drive, or do any exercises. All right? That's why we have somebody drive you home. All right? Once you get home, we recommend that you drink lots of fluids, and you should be able to eat a normal diet afterwards. If you have a lot of abdominal pain, cramping, or you have any bleeding, I want you to call me right away or go to the nearest emergency room and have the ER physician call me right away.
What are the risks of the procedure?
The most common things that can happen after colonoscopy, as I mentioned, could be some abdominal cramping or some bruising at the IV site or minor bleeding if you do any biopsies. All right, but risks of not doing a colonoscopy is far more common than having any of the complications that can happen. All right, there are some other serious complications that can happen during a colonoscopy, but they're extremely rare, and they're all outlined in your consent form that you can review. All right. Any other questions? All right, well, if you think of any other questions, or you have some questions that haven't been answered, I will see you before we start the procedure, and you're more than welcome to ask me any concerns or questions you may have. All right? Excellent. Why don't you come on up, we get you all set up, okay? All right. After you.